My name is Dr. David Benverse, and I'd like to share with you some of the most effective ways that I've found in helping relieve the pain and discomfort associated with TMJ, or temporomandibular joint dysfunction. Now, there are two main therapies that we use in our office that are very effective in helping reduce the amount of pain and symptoms. And by themselves, these two therapies are very effective. But when we use these two therapies together, it becomes even more effective and helps speed up that process even more. Those two therapies are the chiropractic adjustment and also active release. And with the chiropractic adjustment, one of the main things that we're effective in helping out with that is helping to make sure that the disc in between those joints is in a working fashion, and it's also in the right place that it needs to be. If that disc is out of place, that's going to cause that crunching and popping and sometimes the pain associated with that TMJ. So when we're making that chiropractic adjustment, that's going to help open up that space and make sure that the disc in that area is where it needs to be. Then, with regards to the active release that we're going to be doing on that area, particularly we're going to be working on the muscles in that area, because one of the main factors that we see with TMJ is an increase in muscle tightness around that area. So typically we will actually do some active release, or trying to release those muscles before we even do the chiropractic adjustment itself, so that we have a little bit more laxity in those muscles to perform that adjustment even more effectively. Now, when people are through their treatment with us, as far as with the TMJ, they a lot of times tell us that they have a decrease in the amount of pain, they'll have a decrease in the amount of muscle tightness, and they have an increase in the range of motion, as far as not being able, or not having the popping and pain associated with opening their mouth and doing the things throughout their day. And when people are able to experience that, they typically are very thankful, because they're able to do things throughout the day that they haven't been able to do pain-free or without that irritating popping for such a long period of time. And one of the main things is people that are at work and they have to talk a lot, obviously if they have to use their jaw in a very repetitive fashion, and that has now been reduced as far as the pain, they're able to perform better at work, be able to talk more at work, and do their job better at work as well. With regards to their activities of daily living, with regards to personal hygiene and things like that, they're able to brush their teeth more easily, not having the pain or discomfort associated with having to open their mouth up. They're able to chew their food and do things like that without the pain that they used to have or dread, and they might even be eating foods that they've never had before either, because of their avoidance of those foods. And most importantly, or lastly, we're going to be talking about how they're increased their quality of sleep at night. So they're not only falling asleep better and staying asleep, but the amount of sleep, or the rest of the sleep, is allowing them to wake up rested and not having that tired feeling in the morning. So if you're in pain, give our office a call. We'd love to help. You can call us at 618-519-9334.